Barb Miles. I'm your moderator for this session. This session is Integrative Oncology, the role of yoga in cancer care. Our presenter is Smitha Mallaiah. She's a senior mind-body intervention specialist at the University of Texas MD Anderson Cancer Center Integrative Medicine Program here in Houston. She has a yoga therapy clinic and works alongside other integrative medicine clinicians using yoga therapy with inpatients and outpatients going through cancer, from prevention, diagnosis, treatment, and end of life. She's also a researcher and has developed and taught yoga research interventions for various cancer populations. She has also authored and co-authored yoga publications and book chapters and has presented her work at national and international conferences on the efficacy of yoga in cancer care. She is recognized for her work and is honored for her contribution as one of the top 25 people in the United States to improve cancer patients' quality of life by Cancer Health in 2022. For those of you who are attending this session live, if you have questions, please raise your hand and we will come to you with a microphone so you can answer your questions. You can do that at any time. For those of you who are attending virtually, please post your questions in the Q&A box. Speakers may not have the time to answer every virtual question, but if they weren't answered, please send the questions to ThyCa at thyca.org and list the session number, speaker name, along with the question, and we will attempt to get your questions answered. So now I give you Smitha Mallaiah.
Thank you, Barb.
You're welcome.
Can you guys hear me okay? Can you guys hear me okay? Probably a little lower. Thank you, Barb, for that wonderful introduction. Thank you, ThyCa and Gary and all the organizers for this opportunity to be with you guys all to share some of the work that I particularly do in yoga therapy and cancer care. So I'm aiming to do maybe half of the presentation sharing some work, and if we have time towards the second half of the presentation to actually go through some practice helpful to get a firsthand experience. So that's what we will be doing. And as Barb introduced, I work in integrative medicine at MD Anderson. And okay, it looks like probably only the slides are moving only on the slides are moving only on the screen. Okay. So as Barb mentioned, until we get this figured out, I work in integrative medicine. And when we talk about integrative medicine, alternative medicine, complementary medicine, there is a lot of confusion, a little bit of maybe misunderstanding even. So I thought I'll just take that first couple minutes to go through the differences and some commonalities. So as I was mentioning, we hear about complementary health approaches. So what are complementary health approaches? Practices and products of non-mainstream origin. So other than what we hear and see with our doctor's offices, something that is outside that realm. So integrative health is incorporating complementary approaches into mainstream healthcare. So when we talk about, medicine, alternative medicine is used in the place of conventional medicine. So this is when, you might be doing a ginger tea for cough instead of taking cough medicine, but complementary medicine is used together with conventional medicine. And when this happens with the complementary medicine, most of the times it might not be integrated with your healthcare provider, their goals, and what are the common goals for care for an individual patient. But when we come to integrative medicine, this is used together with the conventional medicine in a very deliberate, focused manner that is personalized. It's also evidence-based and safe. So when we practice integrative medicine at MD Anderson, it's not something that is separate from their conventional treatment. This is integrated. So if the patient is experiencing side effects of chemo and the doctor is prescribing some medicines to manage that, the integrative medicine modalities are aimed to support the care that they're already receiving. So this becomes more safe. So everybody knows, especially the medical team knows what is being, practiced by the patient. So integrative medicine is defined as a patient-centered, evidence-informed approach to cancer care that use lifestyle modifications, mind-body practices, natural products, and other different traditions that comes from different traditions in tandem to their cancer care. So Society for Integrative Oncology is one of the leading organizations that works for integrative oncology, looking at all different modalities and supporting the evidence and guidelines that are based. So when we look at integrative medicine model, this is based off the biopsychosocial model where the patient is looked not just as a symptom or the disease that the patient is going through, the person is going through, but it is looked at from the bigger approach of what are the other factors that contribute to the disease or the discomfort that is happening, and how can an approach that addresses various aspects of this care can support an individual to get through the cancer journey in the most best way possible. In our integrative medicine model, so this is the biopsychosocial model that we have, and you can see that there are various practices that are supporting the individual along with the traditional medical system support that an individual patient also gets. Now, this is great, but when we actually look out, this is one of the surveys that was done a few years ago from American Society of Clinical Oncology, which did a national opinion survey actually on alternative medicines. And 4 in 10 Americans actually believe cancer can be completely cured just with alternative medicines without any conventional treatment at all. Now, there is also research and data to support when patients go not to conventional and just to the alternative systems, many times they may end up with advanced disease rather than managing the disease at an early stage. So it is very important to actually educate both providers and patients on when is a good time to bring integrative medicine and how it can be safely integrated within the care system. Again, this was another survey that was done much earlier, and this actually shed light on most cancer patients continue to use some form of integrative medicine, but they don't necessarily discuss the same with their doctors. So this also is important because there are sometimes with herbs, especially drug to drug or herb to drug reaction that can happen with, chemotherapy based medicines, or say, for example, even with yoga. Is all yoga safe? Disturbances of mind. So various understanding that essentially brings us to the goal of not only physical movements are happening, that in turn guides the mind to quieten, to relax. Next slide. Something else that a lot of people ask is, when is a good time to do yoga, right? So a lot of times, the understanding is, let me get through the treatment, let me, finish up whatever is happening because it's so busy when an individual is diagnosed or going through cancer. So I will take yoga when I'm done with everything. But yoga therapy can be applied throughout the continuum from diagnosis through survivorship. So when someone is diagnosed with cancer, we find many individuals in a state of shock, disbelief. Yoga practices can be used to move through the shock right at the diagnosis level. During treatment is when there is a lot of symptom burden that patients are experiencing. This is again a great time to use yoga as well. And end of treatment and survivorship is a time where patients may have lingering symptoms that are unaddressed, right? So this is the experience of many patients. I still have my shoulder that doesn't completely move, but now I'm referred out to therapy in the community because it's not, related directly to my care. So there are a lot of symptoms, not to mention the understanding and digesting the shock and trauma of going through the treatment itself sometimes is, not dealt with. So that's a great time to also do yoga. Something else that might be of interest to all of you, I'll mention a study that we did recently, was yoga also is a great tool actually to give throughout the cancer care treatment as a prehab model. I don't know if you guys are familiar with a prehabilitation. Most of us have heard rehab. After the fact of surgery or treatment, we go to rehab to get some of the movements back. But the idea of rehabilitation is preparing patients to actually be much stronger as they go into these treatment. And also there is the concept of intrahabilitation in between treatments, when patients have some time where they can actually improve their physical and mental health so that they're better prepared to recover from the treatment side effects, is another concept that is very useful. And not to mention, when an individual is diagnosed with cancer and is going through cancer, the spouse, caregiver, or the family goes through significant amount of suppression. We have been very fortunate to actually do research involving caregivers and diets at MD Anderson. And a lot of these practices also support the caregiver to an extent that it can help reduce their physical and mental symptom burden as well. And last but not the least, healthcare providers, right? Patient advocates, people who are around the clock really working and being part of, supporting the cancer people and their journey are also important, and yoga practices can help support their physical and mental well-being as well. Okay, I think I need your help to move the slide. Thank you. What are some of the tools of yoga therapy? Most people, as I mentioned, are very familiar with, physical postures or physical asanas, or the other one would be meditation. But as a yoga therapist, when you work with patients, we actually have a whole set of tools that we can work from our toolbox. It can be gentle movement, strengthening practices, yoga postures, counseling, some diet and food recommendations as well, awareness-based practices, and not to mention lifestyle-based modifications that also can be very helpful. Say, for example, a good example for lifestyle-based modification would be sleep pattern, right? People who have sleep disturbances can actually follow a lot of what Sleep Foundation recommends for sleep hygiene. Don't look at the screen, try to go to bed on the same time. But also, we can add a relaxation practice before bedtime to help calm and relax the individual, so the quality of sleep that they get once they are in the bed can be improved. So all these different tools are there for an individual to work on. Now, is this all something so new that really at the national level or at the policy level, we are not making noise or getting attention? These practices and research that we have been doing are catching the attention of things like ASCO, NCCN. So this was one paper that was published from ASCO, American Society of Clinical Oncology, with SIO that I mentioned, Society for Integrative Oncology, where they looked at the data and did a review on what are some of the best practices that we can recommend for this one, more specifically for breast cancer, but it also follows. Also, what we saw was an increased range of motion for the neck and for the trismus in the yoga group that did the practices. Of the yoga group patients did not have to get a feeding tube because they were able to chew, swallow, and keep the functioning of their head and neck area successfully. So this was not powered to actually look at feeding tube, but that was almost like a secondary effect that we found, that people are able to still chew after 3 weeks or 6 weeks of treatment, and they did not have to get a feeding tube. So these are some areas where it would be hugely beneficial to develop studies. Maybe if there are interested researchers or people, we could develop a study for, thyroid cancer survivors and see how we can support them as they go through the treatment also. You also see paper here with outpatient clinic. So when Barb introduced, she mentioned about the outpatient clinic that is there. A lot of centers carry yoga therapy as a service. Typically, it's in a group setting where, patients get treatment, but they also say there there is a yoga class, go attend, it's great for you. But it is not, again, integrated into the care. So at MD Anderson, patients can come to work one-on-one. So maybe during the treatment, they come and say, I have to go through the neck radiation, head radiation. I'm getting fixed for a mask, but I'm so anxious and claustrophobic, I cannot go through that radiation. They had to fit me in twice already, and I can't go through the radiation treatment. They can take an appointment for yoga therapy, learn techniques to actually manage, balance, calm down, use meditative relaxation practices to prepare themselves, take it as tools with them into the radiation as they can do these treatments. There are a lot of opportunities like that that patients can come in to address some cancer-specific symptoms without pharmacological support, or sometimes minimizing that support and supporting more with things that individual can comfortably already do. Similarly, you see neuro-oncology practice, and we also do group classes. So we have one-on-one, but we also offer group sessions for patients and families that can take. And since pandemic, we have been able to host them online for MD Anderson patients. These are some of the services and the research at MD Anderson. We can move to the next slide. Very quickly, I wanted to put this slide. I do it with most of my conference presentations because many people may not realize the difference between a yoga instructor teacher and or a yoga therapist. Now, both of them do practice yoga, teach yoga. A typical yoga teacher or an instructor needs currently in the United States 100-hour certification, which gives them information about the practices. But a yoga therapist typically need to hold a master's degree or at least 2 to 3 years of study, which includes anatomy, physiology, disease pathology. We have scope of practice, and these individuals are better equipped to get into clinical care models to work with other healthcare providers. So if an individual is having many health challenges, I always recommend start by seeing a yoga therapist, maybe for one session. And as they move into survivorship with less symptom burden, they are definitely safe to go into community-based practices that can be done. So just wanted to put a plug in there for that. Thank you. Why yoga therapy in general? So, right, and I advocate for yoga therapy practices. Yoga practices are very, very, very adaptable. So a lot of times when I get referred for inpatients who might be actually in ICU, who might be recovering from a surgery, who might be recovering with high symptom burden after a transplant, their ability to do so-called yoga is very little, but they can do meditation, relaxation, and other awareness-based practices, breath work, which are all super safe and comfortable for patients. So if you have someone who really needs a big workout out of yoga, you can get their body to move and do the practice. If someone is just in bed and cannot do beyond anything in the bed practice, there are also yoga practices that can be adapted. So the adaptability is a huge factor. And the more you do yoga, the more effective your system responds to yoga, which is almost like the opposite sometimes in drugs, right? When you take a medicine for some time, after a certain time, you want to increase the dose because your body gets saturated to the dose response, right? But with yoga, it's the reverse. The more you do these practices, your system becomes, it has what we call as an accumulative effect. So the first time you were really anxious before your procedure, it may take 40 minutes for you to calm down. But if you have done meditation every day, in 6 months, when you get anxious, you may just need 5 minutes to calm down because your brain, your nervous system is rewired to respond differently. So that's another reason yoga is really helpful. Sorry, back. Cost effective. We know yoga is unfortunately not covered by insurance, but even when people have to pay out of pocket, group classes at most of the places are typically free. One-on-one consultation ranges anywhere from $30 to $40 or $50. So you also live with a changed approach to addressing a lot of your symptoms. And that also is very helpful. A lot of the centers, as I mentioned earlier in one of the slides, offer group classes for patients as part of the care within the hospital system. Let's go. how to find a yoga therapist. If you are interested or motivated to find a yoga therapist, International Association of Yoga Therapists actually have a database of all the certified therapists within the United States. So you can go into their website, put in your zip code, and adjust what is the radius of miles that you want to search within, and you will be able to find a yoga therapist in your area. Another way, if you don't have access to a yoga therapist who can work with you, another thing to do is talk to the yoga teacher or the instructor that you're working with. Tell them some of the important health concerns that you have, which they should pay attention to. And a lot of yoga teachers have additional certifications added to their certification of 200 hour, and many of them will be happy to work with you for that. These are actually a list of resources on MD Anderson's website. This is public facing, so anyone can access these resources. Just look up MD Anderson Integrative Medicine, and it brings up a bunch of these videos that are available for anyone that is touched by cancer. So these are public facing if you guys are interested. And I think that's the end of my slides. I just wanted to pause there. Yep, I think we're about halfway through the session. What questions or comments come to your mind?
Great. Thank you for the presentation. Much appreciated.
You're welcome, sir.
Here's my question. I'm in a disco. I'm aware of integrative medicine. I've heard of it for years, even before my cancer diagnosis 8 years ago. And yet it seemed, even from your statement, that it's not covered by insurance.
Yoga specifically is not, but some other modalities are.
Some of the others are, okay. But even that is almost like a, the medical community at large, the insurance industry that helps pay for the medical community at large. It's almost like their way of going, yeah, it's cute, it's nice, but at the end of the day, it's really just a warm, fuzzy feel good. And it almost discredits, you see what I'm saying? As an outsider looking in, I feel like it is discredited even within the legal, that's my community, even within the medical community. I treated at a large Midwest university teaching setting. And the most I got great care, don't get me wrong, and compassionate care. But an oncologist one day reached her hand across from the seat, put her hand on my knee and said, "How are you doing?" And I knew what she meant by that. She was, more, where's my headspace? How am I internally? That was the most I got. There was not one offer of integrative therapy. There was not one offer of even just sitting down with a clinical therapist just to talk me through my headspace, yet alone integrative. MD Anderson is one of the biggest rock star places in the world for killing cancer. And yet I've got a bunch of friends that treated MD Anderson for their medullary. Not one of them have spoken in our group or to me personally about integrative care that they are receiving. There's a question in here. I think you know what it is without me even asking it. How do we bridge this gap to where integrative medicine, integrative treatment, integrative, therapy, yoga therapy becomes a common modality that is part of the routine? It's when you're diagnosed, it becomes part of the routine and normal conversation that is offered to a patient, made aware, and then ultimately comes just as big a part of a treatment as is surgery, as is radiation, chemo, rehabilitation, swallow therapy, all those things. How does it just become a normal standard part? And how frustrated are you that it hasn't been so far? There's the question.
Right. That's $1 million question. Every word you spoke and every piece of the question is so valid, and it is something that we experience and kind of like are living through as we bring integrative medicine to the forefront. So there are a lot of things done to increase the awareness. Like say, for example, you mentioned at MD Anderson itself. So at MD Anderson, a lot of patients, go through the treatment and they're like, oh my God, I didn't even know integrative medicine was there. Just for those of you who are not aware of MD Anderson numbers, currently we see about 170,000 patients in a year. So that's like huge numbers, like huge. And we have 4 medical oncologists in integrative medicine, 3 APPs, advanced care providers, and the list goes down at integrative medicine. If every patient had even like one consultation at integrative medicine, half of MD Anderson would be integrative medicine faculty and folks, because that's right, because every other department just says patients who come to them. But we, as integrative medicine, could potentially see everybody who walks through MD Anderson doors. So that is a bigger challenge that probably needs to be looked at from various angles. But few things that we're doing. Right now, when you land on MD Anderson's page, within the second click, you can actually find integrative medicine and everything that the patient goes through. When patients get enrolled for MD Anderson, they also get, as you know, overwhelming amount of paperwork, but that also includes the integrative medicine services that they can always access to manage care and manage their symptoms. But at the bigger level, like the change that you're talking about at the national level and things like that, some of the papers and research that I'm trying to show is an effort towards that. Can we get actually more of these, organizations to recognize, to release guidelines? Because I think with drug studies, I don't know if anybody who does drug research is in the room, but typically you have drug studies and you have these class 1, class 2, class 3 drugs. They have efficiency, you get approval, then the gets released into the market. Or many integrative medicine, one of the challenges that really also is pulling back the field is the variability, the variety within the field. Say, for example, what I call as yoga, somebody else might be doing yoga completely differently. They might just be doing breath work. So when we recommend, oh, let's do yoga, the next question for insurance people would be like, what type of yoga are you talking about? Do you have class 1 research for this type of yoga to be released and approved into the market? Say, for example, other traditional medicines like Ayurveda or sometimes even TCM, similar things happen because the approach of science is very reductionistic. So you can pinpoint the reason exactly. The approach of Eastern traditions and a lot of integrative medicine modalities is synergistic. It's exactly the opposite. So it doesn't fit into our nice, insurance, framework so we can get approved. So anyway, it's kind of like a whole discussion we can have for the next 3 days and we can go on and on. But this presentation today is an effort to educate on that, right? So there is a lot of things that we can do at the grassroots level, patient advocacy, caregivers. There is also a lot of effort. I personally try to go to regular conferences and present to medical oncologists and folks on saying, we have all this research. This is great. Let's present a case study. Would you be interested if your head and neck patient felt better, if your ovarian patient felt better? So there's a lot that is going on. And some of these fields, especially like yoga therapy, is in its beginning stages to really be integrated. But within any other care, cancer is one of the places that we're like really moving up and moving forward. So there is a big discussion on billing codes for patients, can actually billing codes for yoga therapists, so we can start actually billing. Now, there are other providers who could bill for yoga therapy practices and under other billing. It could be stress management. It could be anxiety management using. So there are codes that are there. So in every way, there is a movement that is happening, but unfortunately, today we kind of like don't see it. Maybe in about 10 years, we'll be like, oh, 10 years ago, I had heard a presentation and look what has happened today. But thank you. Your question and comments just show a lot of care and enthusiasm for bringing these practices forward. Any other questions? Nothing online? Okay. Yes, yes. Ma'am.
so that you can be heard.
My question is about what the slide you had that had all the different integrative modalities that you're using. I'm very involved with therapeutic horticulture or horticulture therapy. Are you guys doing anything about time spent in nature as part of your?
Not right now. Not right now.
It's pretty hot outside here in Houston, so I don't know. But anyway, I just wondered if y'all were doing anything with that.
No, but we do know the importance and therapeutic effects of it. I think just not too long ago, a week or two ago, I was just like discussing with one of my patients who came in, and in yoga, we have this concept of increasing vital energy or prana. And one of the things yoga recommends is to be with nature, without any devices and things like that. So even from traditions like that, there is a very beautiful overlap and importance of actually connecting and going back to nature in many different ways. I'm very glad to know that you're doing that.
Any more questions?
We could do some movements if you guys are okay. Yeah. I think there is a hand up on the.
You're working, I don't need the microphone. You're working in a large medical center that's, like Phil said, is, well-defined for treating people, with advanced cancers and whatever. Think about all the community places that are doing that, and how do we get people like yourself out there? That's another, direction that we need to go.
Absolutely, right? Thank you, folks. Thank you so much. Let's take a seat. Come to a comfortable position. See if you can keep your feet flat on the floor. Feel your hips. Gently lengthen your spine. Keep your chest open. Relax your shoulders. And take a moment to bring awareness to your breathing. Notice any sensations at the body level. Any sensations in terms of circulation, pressure, anything that your body brings up. And if nothing particular, that's okay too. Take a note of your breath. See if you're breathing through the nose, mouth. Bring awareness to the felt sensation of breathing. Do you feel the breath in your chest, in your belly? You don't have to change anything. Simply, you're developing awareness. Another slow breath in. And as you breathe out, feel free to gently open your eyes. We will go for some movements. Bring both your hands in front of you. I'll use the mic with one hand. So let's start with some finger loosening. Put your thumb in, make a nice tight fist. Nice tight fist. Exhale, stretch your fingers out. Inhale, make a nice tight fist. Get all that circulation to the tip. Grip it nice and tight. Exhale, stretch. Inhale deeply. Exhale fully. Inhale deeply. Exhale. Inhale, roll your shoulders front and up. Exhale, back and down. Inhale, front and up. Exhale, back and down. Couple more rounds. Breathe in and out. Please take any chair. We are doing some movements. Welcome. Inhale up. Exhale down. In the reverse direction. Shoulders back and up. Exhale, front and down. Some gentle movements, bringing circulation to the shoulders. Inhale up and exhale down. Moving on to some movements to the neck area. Up and down, first movement. Inhale, slowly look up. Exhale, bring your chin to the chest. Inhale, point your chin up. Exhale, press your chin down. Couple more rounds. As you do this gentle movement, notice any tightness or tensions that you may feel. Breathing in, up. Breathing out, chin to the chest. Come back to center. Now slowly move your neck to the side, any side, and drop the opposite shoulder. If your neck is to the right, Take a moment to really sink and relax the left shoulder. Now stay there. You can go for a gentle nod as you inhale, exhale, move up and down, move up and down. Inhale, come back to center this time. Move and stretch to the opposite side and take a moment to relax the shoulders so that stretch deepens along the line. Now inhale and exhale. Inhale up, exhale down. Notice any tightness, release it, come back to center. One last movement is neck rotation. So inhale, slowly move to the side and back. Exhale, left and down. Inhale, side and back. Exhale, left and down. One more round. Inhale and exhale. In the reverse direction, inhale and exhale. Give yourself the permission. Focus on the practice. Notice any sensations, tightness. Use the breath. Inhale and exhale. When done, you can stop the practice. Take a deep breath and relax. We'll do some facial exercises, facial yoga practice. The first one that we will do is a jaw movement or a jaw opening. This practice is also called as a lion's stretch. So you all can become lion and lionesses now. So when you inhale, you want to open your mouth nice and wide so you get that deep stretch in the jaw. We are also going to stretch the tongue. So it's going to be as if a lion is roaring. We don't have to make the noise. Right time you're entering, please come. All the lions are roaring. Inhale, take a deep breath. A big lion's roar with mouth wide open. Relax. Take a moment to relax the jaw. We'll do 2 more times. Inhale. Relax. This is part of the practices that we use for head and neck cancers, strengthening the mouth and the throat area. Last one. Inhale. And relax. Bring one or both your hands underneath the chin and gently push your jaw up. You will create a little bit of resistance. Your urge is to drop the jaw open, but your hand is pushing it up. So you will start engaging the neck. Relax. We'll do that one more time. Nice and gentle push up and relax. A couple more stretches to relax any facial tightness. Lip stretch. On a side note, when we did our head and neck cancer study, we had a lot of both female, male patients, but for some reason we had a lot of male patients enrolling, and we had their spouses also come and do these exercises. And, I told them, if you did this regularly for 3 months, you'll get a facelift. Oh boy, the adherence was high. Okay, next practice we will do is going to be a breathing technique, hands in front of you. Inhale, begin to slowly open your arms sideways. Exhale, bring hands back together. So I want you to breathe as you move the arms. Inhale. Exhale, bring hands back together. We'll do that for 2 or 3 more rounds. Inhale, open your arms, your heart center. Exhale, bring arms back together. Inhale, expand your chest, bring in that air to the lungs. Exhale, arms back, center. One last one if you can still do. Inhale, open and expand those intercostals, bringing nice deep breath in. Exhale, hands together. Great going, guys. Release those arms, relax the shoulders. Next practice, interlock your fingers and inhaling will stretch the arms above your head. I want you to press your feet down, hips down, and lift up the spinal column. Nice and long, nice and long. Slowly stretch to your side. Center. Stretch to the opposite side. Center. Now, as you release the arms, bring your right hand to the left knee and slowly move, twist from your waist. Breathe here as you hold. One arm is holding the backrest of the chair. Let's switch. Bring your left hand to the right knee. Hold the backrest. Feel that nice twist in your waist. Come back to center. Release both hands. We'll just spend the last minute in awareness. If it's okay for you, gently close your eyes. If you prefer to keep them open, look down with a non-focused gaze. After the movement, notice any sensations that you can still observe at the body level. Movement of that shoulder, stretch in that muscle, movement of that lower back, mid back, and notice any thought. Guide your mind to simply notice and be present with the body. If there is a chatter, conversation within the mind, simply notice it. You don't have to push it, react to it. As you feel your toes, relax your toes, ankles. Relax the knee joints, hips, pelvis. Feel your abdomen and chest expand and rest as you breathe. Relax all the back muscles, shoulders, arms. Bring awareness to the head and neck area. If it's okay, swallow a little bit of saliva. Relax your mouth and throat. Relax your eyes, eyebrows. Completely relax the whole body from head to toes. Deep inhalation, energize your whole body. With a complete exhalation, relax as you return to here and now. When you are ready, gently open your eyes. Thank you all for your kind attention. Thank you.